Dr. Daigh, you had said earlier today, I believe, to Chairman Miller that you did not conclusively examine all the medical records to determine if patient deaths were related to delays in care. Yet in the report your colleagues released, it said, quote, the IG's final report in August concluded that it could not conclusively assert that long wait times caused the deaths of these veterans. Can you explain to me and to the families who are watching today who have been going through this, especially if they've lost loved ones, how can the VA emphatically say to us that you can determine no link between wait times and deaths if you didn't examine all the records?
So let me clarify. We examined 3,409 records. To the Chairman's point, we did not examine all the records of patients on the near list. That would be people who said they wanted care at VA if they never actually made it through the maze and got an appointment. So if there was no record for me to review, given that the electronic medical record was our main source, then I could not review those cases. All of the cases that we were able to review came from a whole variety of lists, most of which had to do with waiting lists that we found at Phoenix. So in those cases, we did, I think, very thoroughly review those cases. And in those cases where we determined that there was harm, the delayed care caused harm, we published those. And in those cases where we found improper care, we published those. So we have 28 cases that we thought people were on a waiting list, and as a result of being on a waiting list, they were harmed. We have an additional 17 cases where we thought the standard of care wasn't met, and so we published those cases. I think that I'm not trying to say to people who couldn't get there, who through frustration couldn't make it through the barriers, I'm not trying to excuse anything at the VA. I'm only trying to answer a fact. On these people, on the cases we looked at, did we see a significant impact on their care because they were on a waiting list? And that's what we found, and that's what we published. I'd further say that I don't believe that our review necessarily needs to be determinative, in the sense that I put the scenarios out there hoping the citizens would read these cases and would understand the complexity that these veterans present, and understand the difficulty that they have, understand the fragility of these cases, so that when they don't get care in a timely fashion, horrible things are likely to happen. And each person then can read these cases and they can decide whether a person who might have unfortunately committed suicide, do they think that was related to timeliness? They can make their own decision on that point. So I offered the opinion of my office, which has the ability to see lots of data that's not in these summaries intentionally. A lot of the data is unnecessary for the basic fact pattern. These families have a right to privacy, so we try to be very careful about what we decide to publish with respect to facts to a case. So to the issue that people would like more data about these cases, I understand it, but I think that the VA needs to ensure that veterans have access to care that's done appropriately, that the trains run on time, and in that way the VA can deliver proper care.
I'm just curious, if you had a chance to go back and reinvestigate these cases and the procedure, would you do it differently today?
No, I wouldn't. I think the way we did it is the way we've done this for many, many years. I think it's very thorough, and I think it produces a fair result. What I would wish we had, which I wish we had not been tied to, was this issue of timeliness, trying to explain the impact of being on a wait list with quality care. That's a totally made-up standard based on the circumstances of the complaint at this case. If I could have picked something different to look at, we would have thoughtfully come up with a different test. But that's the test we were presented with, and so that's the test we had to try to address.
Thank you. Thank you, Mr. Chairman. I yield back.
Thank you very much. Ms. Brownlee.